I just wanted to take the time to make a video to show you how to complete the neonatal sepsis score. So over here we have Epic Playground. This is not what we currently see in Epic, but it's going to calculate the same way that we do currently. This is how it looks in Epic right now. So each category plays a different role in determining the risk for sepsis. This is why it's crucial to input the correct information into each category. The highest maternal temp is one factor that may change. If her temperature has increased from her current highest temp before delivery and it has been 1 hour or less from the delivery time, we need to add a column and change the temperature. For example, mother delivered at 10 a.m. Her highest temp before delivery was 99.1. Her temperature was re-obtained at 11 a.m. and it was 100.4. We would go ahead and add a column, and we're going to input the same information here except for the highest maternal temp. That's one thing that would change. And then you're going to get your updated sepsis score here. So defining adequate antibiotic prophylaxis. Antibiotics are commonly scored incorrectly. Incorrect antibiotics can alter the ultimate score, which can lead to a delay in care. So our GBS specific antibiotics would be your ampicillin, penicillin, and Ancef. Over here we have broad spectrum antibiotics, and those would be antibiotics like gentamicin. Vancomycin and clindamycin are likely to provide some protection, but they still need to be marked as no antibiotics. These are typically given in the event the mother is allergic to penicillins. Antibiotics that is administered minutes prior to the delivery also need to be counted as no antibiotics. So in order to define adequate antibiotic prophylaxis, the antibiotic treatment needs to be administered at least 2 hours prior to delivery. If there is not a rupture of membranes time documented, we should communicate with the labor and delivery nurse. Maybe they just forgot to document something. There also may be some circumstances that are uncontrollable, such as an outside delivery where the rupture time truly is unknown. We just need to make sure that we're notifying the provider of that. So this sepsis calculator will calculate like the one we have in Epic. This is just a good visual on how the providers decide a plan of care depending on the different classifications. Our role as the RN is to put the correct information into the calculator in Epic. The provider determines the plan of care based on these calculated values. Here you will see what we see in Epic and also that visual on how the providers may determine different treatments based on those calculated values. We need to call the provider when the risk at birth score is greater than or equal to 1. So greater than or equal to 1. This will tell us we need to change the frequency of our vital signs to every 4 hours for 24 hours, because that is the recommendation. It is vital that we report changes in the vital signs to the provider, because if they are showing signs of sickness, they're going to be started on antibiotics. So here is a scenario. Baby boy was born at 14:24 with a gestational age of 39 and 1. Upon admission, baby boy had a temp of 98.4, heart rate of 135, and respirations of 47. Maternal temperature was 99.2. GBS and all labs were negative. Mom was ruptured for 4 hours and 52 minutes. Labor and delivery reported that she had a sudden fever and occurred near the end of labor. There was no antibiotics received during birth. Now baby boy has a fever of 103.8 and tachycardia. So what will the sepsis score be from this scenario? So we have, she is 39 weeks, 1 day, The highest maternal temperature was 99.2. She was ruptured for 4 hours and 52 minutes. Now, this can get a little confusing because the rupture time isn't always on the hour on the dot. So we can go ahead and take whatever minutes we have and put it into decimal form. The way we do that is you take the number of minutes and you're going to divide it by 60. So for this example, 52 divided by 60, we get 0.86. So here we're going to put 4.86. The maternal GBS status, she was negative, so that's 2. And then type of antibiotics, that's 0. And just remember, I have this to where we can't see it, but it tells you what number it should be. It tells you exactly what you need to know so you're not just guessing. All right, so what will the sepsis score bring? 0.18. So mother's temperature was checked 50 minutes after her delivery. It was 103.5. So we need to change that sepsis score because it's only 1 hour. It was only 50 minutes after delivery. So it's within that 1 hour. We need to make sure it reflects the new temperature. So we add a column. And we're going to input the information. This is going to be the same. This one's going to be the same. This one will change. So it's 103.5. This will be the same, 4.86, 2, and 0. So see how that significantly changed our risk at birth? It is now 7.4. So we need to make sure that we are notifying the provider as soon as possible. So it is very important for us to know the policy when it comes to our vital signs. So we know when our vital signs are out of parameters. We will always follow our policy unless there's an order from the provider for different parameters. The provider may use the term equivocal. This is just a different category that the provider may change the plan of care based on the recommendations from that category. It is not the RN's responsibility to determine if the infant falls within different groups, but it is the responsibility to report changes in vital signs. This is for knowledge only. This is just so you know how they determine if an infant falls under the equivocal group. The newborn has to have persistent physiological abnormalities for greater than or equal to 4 hours, or 2 or more physiological abnormalities lasting greater than or equal to 2 hours. So these are our abnormalities. So for this one, they could have 1, but it has to be for 4 hours or more. If they have 2 of these, it has to last for 2 hours or more in order to be placed in the equivocal group. Again, this one is just for knowledge. Here's an example of how this may transpire. Your baby who is transferred from L&D, whose risk at birth was 0.25. You notice that the baby had retractions and flaring and was not breathing, and was breathing 75 breaths per minute. The RN should call the doctor due to changes in vital signs, and they, the provider, may, if abnormalities have lasted long enough, classify them as equivocal, which will change the baby's vitals to every 4 hours and would need a blood culture if the provider desires to do so. If you have any questions regarding the neonatal sepsis calculator, please do not hesitate to ask me. I wanted to ensure that we're putting the correct information into the calculator for the providers, but I also wanted to ensure that you knew how to do it.